Assalamualaikum and hi everyone. We are from Group 1 representing our topic, which is Congenital Insensitivity to Pain and Anhidrosis or CIPA disease. Before that, let us introduce ourselves first. My name is NUR ELYA BINTI HAMZAH with a metric number 163448. I am a second year student from School of Physics and majored in medical physics. In this video, I am in charge as a presenter and a script writer.
Assalamualaikum and hi everyone. My name is FARAH AMALIA binti NAZRI with a metric number 164160. I am also a second year student from School of Physics and major in medical physics. In this video, I am in charge as a presenter and editor. To start our presentation today, let's watch a video first.
그러게요. 마취 안 했는데요. 마취. 선배. 뭐지?
왜 그랬어? 네 병 증명하려고?
어떻게 하셨어요, 교수님?
Based on the introduction video, we can see that the patient approaches the emergency department with a bleeding arm. However, he did not show any sign of pain. It is one of the signs of the CIPA disease. CIPA is one of the rarest diseases that were found in this world. It is caused a person to not be able to feel pain and sweat, which is where the word of anhidrosis exists. It is also known as hereditary sensory and autonomic neuropathy type 4, HSAN4. Hereditary because it runs in family. Sensory because it affects the nerve controlling sensation in the body, which includes pain. Autonomic because it affects the autonomic nervous system, which regulates sweating. This condition usually manifests during early infancy and can lead patients to suffer from repeated injuries. This disease can be diagnosed by taking a small tissue sample and look at it under a microscope to look for undeveloped nerve and no sweat glands. This is a little bit of introduction for CIPA disease. Now, I will pass the mic for my partner Farah to continue the presentation.
Thank you, Elia. Alright, now I will take my part. As we heard what my partner briefed about this disease is just now, it is the rarest disease that ever exists. Now, how we will detect or identify any system that lead to CIPA? First and foremost, CIPA is a disease that a child is born with congenital. A child who has CIPA cannot sense pain or temperature. They do not feel pain and cannot sweat or do not sweat enough. It is easily detected when a parent or caretaker notice their child is unaffected by things that should hurt. For example, you might think that your baby is tough for no crying when they get vaccination, but that could be a clue that they are not experiencing pain normally. The babies also easily get infectious or have injuries that do not heal because they do not instinctively care for them and try to protect them from things that would cause more pain. Other than that, anhidrosis, which is lack of sweating, in addition to not feeling pain, children with CIPA cannot sweat or have decreased ability to sweat. This makes it harder for them to control their body temperature and can lead to heat-related illness such as heat exhaustion and heat stroke. The other CIPA symptoms include slow healing from skin and bone injuries, chronic bone infection, dental cavities, and so on. I think that concludes how we can detect the CIPA disease. To proceed with our topic, let me tell you how we can handle this disease. As we already know, this disease is one of the chronic diseases. So, how we can treat it? Unfortunately, CIPA disease has the same like with cancer, which is there is no cure for it. There is also nothing can be replacing missing pain sensation or make you sweat more. Treatment for CIPA is about living as safely as possible with the condition. For caregiver of children with CIPA, This means teaching them how to manage their activities and care for themselves, since they won't be getting pain or temperature signal to help them out. Let me give an example on how this works. As we are aware, CIPA patients are lack of pain. Pain is a body alarm system. Without it, you may not know that you have injuries even if they are serious. You may re-injure yourself regularly because there is no pain to signal to help you avoid doing so. Also, for CIPA patients, they are lacking sweaty. Kids with CIPA also must learn how to manage their activities when they cannot sweat enough to cool their bodies. For example, overexertion in hot environment, stay in the shade as much as possible when outdoors, rest often in the heat, and so on. I think that's all from my part. I will pass to my partner for the next part.
Thank you, Farah, for all the information. Our video already reached the last part. Before that, let me conclude all of it. CIPA, a rare genetic disorder. Unfortunately, there is no cure for CIPA, but it can be managed with a strict lifestyle to ensure safety. These coping strategies should be implemented as soon as the diagnosis is made and adjusted as needed throughout the child's life. Since CIPA is an inherited disorder, adults with the condition should discuss it with their partners if they are considering planning for a family. It is crucial to have support from those around us to navigate through CIPA easily. In conclusion, while managing CIPA can be challenging, it's possible with the right strategies and support system. That's all from us. Thank you for watching.